Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is the indications for spinal discectomy surgery for sciatica. Sciatica occurs in 1 to 2% of the population at any point in time. Most people have no clue what they did as an inciting event. It could be a sneeze, it could be a small fall, maybe just be waking up that way. It's typically a result of slow disc degeneration that results in a tear where the inner part of the disc squeezes out. In layman's terms, that's a slip disc, or it's also called the lumbar disc herniation, prolapsed intervertebral disc, what have you. The symptoms of sciatica may be variable, and it's a result of the nerve root that gets inflamed from being pinched. It can be leg pain, it can be burning, searing, pins and needles sensation, possibly numbness, weakness, and rarely incontinence. That's a surgical emergency. Initial treatments for sciatica should include a short period of bed rest. The old adage of a week in bed is bad news, just a little bit, as little as can be tolerated, actually. Over-the-counter medications may include anti-inflammatories and Tylenol. Physical therapy, chiropractic, spinal decompression therapy can be beneficial. Prescription medications may include a Medrol dose pack, narcotics, muscle relaxers, neuropathic medications like Lyrica or Neurontin. Interventional treatments may consist of trigger point injections and then the gold standard epidural injections. There are 3 types of indications for sciatica surgery. One is absolute, means you got to have it, there's a serious problem, no question. The second one is a relative indication, where there is an indication for surgery but you don't have to have it. And the third is quality of life. The treatments just aren't working, and really there's no motor weakness or whatnot. It's just a matter of pain and numbness. So absolute indication is cauda equina syndrome. This results from severe compression on the end of the spinal cord. It may cause irreversible bowel or bladder incontinence and trouble walking if it's not treated right away. Okay, so basically what you have is a very large disc herniation pushing back on the remnant of the spinal cord, and it can cause irreversible damage if not treated right away. Now, a relative indication for sciatica surgery would be motor weakness. If you have a foot drop, meaning it's trouble lifting up the foot, that can be a result of an L5 pinched nerve, and it's not something that has to have surgery right away. You can watch it for a while. The question, though, is if you continue to watch it and watch it and watch it, you may end up doing a technically perfect surgery and not get better at all. So there's always that to keep in mind. And now, if it's progressively getting worse, like you had a partial foot drop and then it goes on to a full foot drop, then you should really think about having surgery because you know that the situation is getting worse. Now, when it comes to elective quality of life, if you have over 6 weeks of conservative treatment with the various options mentioned, like medications, injections, spinal decompression, and it's just not working, then the indication is there, but it really is a quality of life decision. Less than 10% of individuals will end up needing sciatica surgery. Over 90% good to excellent results occur for those who do have surgery. In 2006, there was a landmark study in the Journal of American Medical Association looking at surgery versus non-operative treatment. At the 1-year point, outcomes were identical. They did show that surgery ended up helping patients get back to work faster and getting out of pain faster, but if the pain can be tolerated, the outcome's no different at 1 year, and you were able to avoid the potential risks of surgery. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 different treatment options. The average success rates exceed 90% with the board-certified award-winning doctors. Visit us online today at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.